Assalamu alaikum. Bismillahirrahmanirrahim. In this video, we are going to discuss about the Norma Lateralis, the bones forming this norma, and the sutures which are shown in this norma, and some important features, and the attachments on the Norma Lateralis, and at the last, structures passing through the foramina which are shown in Norma Lateralis. First of all, we will see the bones. This is the frontal bone, and this is parietal bone, this is temporal bone, this is occipital bone, and this is mastoid part of the temporal bone, and this is zygomatic bone, and this is maxilla. These bones are taking part in forming the norma lateralis. And then we will see the sutures which are present in this norma. Above this suture is present between the frontal and parietal bones. This suture is called coronal suture, and this suture is called temporo-parietal suture. This is called the parieto-mastoid suture, between the mastoid part and the parietal bone. This is parieto-mastoid suture. This is occipito-mastoid suture, and this is the point where the this is called the lambdoid suture. This is point where the 3 or 4 sutures meet. This suture is present between the mastoid part of the temporal bone and the occipital bone. This suture is called the occipito-mastoid suture. Here this suture is the frontozygomatic suture between the zygomatic bone and the frontal bone, and this is zygomatico-temporal suture. These are all the sutures which are shown in this norma, and now we will move towards some important features of this norma. First of all, we will see the temporal lines. Temporal lines are the lines which are anteriorly it is single line which starts at the zygomatic. This is zygomatic process of the frontal bone. The temporal line starts here and arch backwards and superiorly and crosses this coronal suture. Coronal suture is present between the parietal bone and the frontal bone. When the temporal line crosses the coronal suture, it divides into 2 lines, superior temporal line and the inferior temporal line. The superior temporal line, as it moves backwards, it fades and eventually fades, and the inferior temporal line continues backwards and downwards and then moves in the zygomatic arch and continues in the zygomatic arch. The second feature of this norma is the zygomatic arch or the zygoma. Zygoma or zygomatic arch is the horizontal bar on the lateral side of the head. This is the zygomatic arch. This is formed by the temporal process of the zygomatic bone. This is temporal process of zygomatic bone and the zygomatic process of the temporal bone. Here these 2 processes join and they form the zygomatico-temporal suture. This suture is called the zygomatico-temporal suture. And this on the lateral aspect, this is subcutaneous. This arch is subcutaneous. It is wider anteriorly and narrower posteriorly. Above the zygomatic arch, this area is called the temporal fossa, where the temporalis muscle attaches, and on the lower side of the zygomatic arch, masseter muscle attaches. When we clench the teeth, the contraction of these 2 muscles is felt on the lateral side of the head. As we have discussed, the arch is separated from the skull by a gap. This gap is wider anteriorly and narrower posteriorly. The arch has the upper and lower borders. The anterior end of the upper border is called the jugal point. This point is called the jugal point, and the posterior end is attached to temporal bone by anterior and posterior roots. The root which is joining anteriorly. This is called the anterior root, and this portion is called the posterior root, which continues as the supramastoid crest. And on the lower surface of the zygomatic arch, this area is called the articular area. Here the mandible, the condylite process of the mandible articulates in this way. And anterior to articular fossa, here is a tubercle which is called articular tubercle, and behind the articular area there is tubercle, a small tubercle. This tubercle is called the postglenoid tubercle. And the next feature is the external acoustic meatus. External acoustic meatus is an opening which opens into the air. Anteriorly and inferiorly, it is bounded by a tympanic plate. This is called the tympanic plate. This is the part of the temporal bone. This is called the tympanic plate, and this elevation is called the styloid process. Here attach three muscles and two ligaments. We will see it further. And on the lateral side of the lateral side and backward, there is a triangle. A triangle is bounded by superiorly by the supramastoid crust, and anteriorly and inferiorly by posterior margin of the external acoustic meatus. And here lies an elevation which is called the suprameatal spine. Here lies sometimes an elevation. This elevation is called the suprameatal spine, and this triangle is called the suprameatal triangle. Suprameatal triangle, and the lateral boundary of the suprameatal triangle is formed by the and tangent to the external acoustic meatus. As we draw the tangent, there is the one boundary, and this is the second boundary, and this is the third boundary. In this way, a triangle is formed here. The importance of this triangle is that the deep to this triangle, the tympanic or mastoid antrum is formed at the birth. The thickness of the bone at this triangle is 1 millimeter. And in the adults, the thickness of the bone at the point of this triangle is 12 to 15 millimeter. Now we will move towards the next feature, which is the mastoid part of the temporal bone. Mastoid part of the temporal bone articulates with the squamous part by a lightly visible suture. This suture is called the squamomastoid suture, and the posteriorly articulates with the parietal bone by a suture called parieto-mastoid suture, and posteriorly it articulates with the occipital bone and form the occipitomastoid suture. The point where the occipitomastoid suture, lambdoid suture, and the parieto-mastoid suture joins, this point is called the asterion. Asterion is a posterior or lateral fontanelle or mastoid fontanelle. This fontanelle closes at the age of 12 months. This is called the mastoid process. Mastoid process is a breast-like process. This is called the mastoid process. And behind the mastoid process, there lies the foramen, which is called mastoid foramen. Next feature is the temporal fossa. It itself is a lengthy topic. Now we will briefly introduce it here. Temporal fossa is bounded above by superior temporal line. Superior temporal line forms the upper boundary, and inferiorly the upper border of the zygomatic arch bounds the temporal fossa, and the anteriorly temporal fossa is bounded by frontal process of the zygomatic bone and the zygomatic process of the frontal bone. These are the boundaries of the temporal fossa. The anterior part of the floor of the temporal fossa is crossed by H-shaped suture. Here is the H-shaped suture. anterior superiorly we see the coronal suture, and this is the mastoid suture, temporo parietal suture, and it is a point where four bones meet. It is a point where four bones meet: the frontal, parietal, temporal, and the greater wing of sphenoid bone. Here, this point is called the pterion. Pterion. This is the weakest point of the skull. In roadside accidents, this point may damage, and below the pterion, three important structures are present. First is medial meningeal artery, medial meningeal vein, and anterior division of medial meningeal artery, and third important thing is the stem of the lateral sulcus of the brain. In roadside accident, medial meningeal artery may get rupture here, and which may cause extradural hemorrhage. In this way, this point is the most important point of the skull. Below the zygomatic arch is the inferior temporal fossa and another fossa which is called pterygopalatine fossa, which will be discussed in further next topics. And now we see the attachments on the Norma Lateralis. First of all, we will see the superior temporal line. On the superior temporal line, the temporal fascia is attached. As temporal fascia attached above on the superior temporal line, on below on the zygomatic process and upper border of the zygomatic arch, and on the medial surface of the zygomatic arch, and on the lower border the muscle attaches which is called the masseter muscle, and from the whole of the temporal fossa the muscle originates. This muscle is called the temporalis muscle. From the inferior surface of the zygomatic arch, here is a tubercle. From this tubercle, the lateral ligament of temporomandibular joint arises, and on the posterior aspect of the mastoid process, three muscles originate, named as sternocleidomastoid, splenius capitis, and longissimus. We will see SSL to learn. This code will be useful. SSL, sternocleidomastoid, splenius capitis, and longissimus. And now from the gap between the zygomatic arch and the temporal and the skull, from this gap three structures transmits: tendon of temporalis muscle and deep temporal vessel also pass through this gap, and deep temporal nerves also pass through this gap. In this way, the discussion of the normal lateralis is completed. Thanks for watching.